A new study has found that nearly a third of Singaporeans put on the pounds during the COVID-19 pandemic. Market research firm Ipsos says that the average weight gain was about 5 kilograms. Now, the data was culled from 500 interviews among adult Singaporeans. More than half of those polled said that they were trying to lose weight, although only a few said that they were doing so to reduce their risk of severe COVID-19 symptoms. The top methods to shed the kilos were to exercise more, eat less, drink fewer sugary drinks, and to eat more healthily.
And joining us is Associate Professor Yusuf Ali. He's Program Director for Nutrition, Metabolism and Health Research from the Lee Kong Chian School of Medicine at NTU. Professor Yusuf, I would assume a pandemic would make most of us more aware of our physical or mental health. But this new study, we don't see a clear trend. So as an example, more people did more exercise as opposed to doing less. But we also saw more drinking more.
Yeah. Thank you so much. I had a look at the survey results and I thought it was quite interesting on two accounts. The first account was that, while we talk about people and, a sizable number of people gaining weight, there was actually an equal or slightly less fraction that was actually losing weight. And this is in line with many of the other surveys that were done internationally, looking at far more respondents in the tens of thousands or even in the millions, where we found that it was actually normally distributed. We had people that had lost weight. We had people that had gained what we call a fair amount of weight, which is about 1 or 1.5 kilograms. And of course, we had people, like this survey suggests, that had gained more weight, which is up to 5 kilograms or 4.8 kilograms. And I think among the people that gained weight in that group, that 30% group, that average that was reported, that was the second thing that I picked up upon. That average was actually quite alarmingly high. I wouldn't expect such a high level. Be reminded that even pre-pandemic, right, the average in Singapore was trending over the last 10 years upwards as well. But this new study shows that perhaps there is more source of concern for this.
So, to that point of concern that you have, Professor Yusuf, I mean, what are the risks associated with gaining? With specifically the average amount there was about 5 kilos. So, would that be considered dangerous or a danger to health?
Yes. So, I think when you look at 5 kilograms over a year for a normal individual, a normal adult, that is considered high. And I think, well, one could consider the weight that I'm gaining, right? Is it fat weight, right? Is it weight around the belly? Is it belly fat? Or is it muscle mass, right? If it's muscle mass, it's not so much of a concern. If it's belly fat, it's a big concern because numerous studies have now shown that belly fat actually correlates very well with the incidence of what we call a constellation of diseases known as metabolic syndrome. So these are diseases that include cardiovascular disease, diabetes, stroke, and many others.
Professor, if the pandemic had to do with people gaining weight as we return to so-called normal life, for example, more of us returning to the office, would this weight not also drop off?
I would expect it to drop off, definitely. I think the danger here that we might find ourselves quite readily into is that we cannot normalize this change in body weight. We cannot think that, oh, this is normal, right? We should think about what we had before and we should have targets about where we want to set ourselves in terms of weight. And when I speak in terms of weight, I'm talking about change in weight. I think the change in weight is something that has to be watched more carefully. And when we go back to work, I know working from home, the stress that is related to uncertainties of the pandemic has certainly added, and it's a risk, not only a risk factor, it's an external factor that's well known, right? That stress can cause people to gain weight and things like that. And because you're less mobile, you don't take a transport to go to office, from offices you don't take walks to go for your lunch and back and things like that, that has certainly taken a toll in terms of activity. And we do know that the effect of physical activity, even if it's a few steps, even if it's standing up from a sitting down position, do make a difference. And all of these actually do add up. And, so think about the steps, think about trying to, normalize it, to think about how you were pre-pandemic and all that, and try to get those activities back. And I think one thing that we also have to be cognizant about is as we, go through this pandemic and as we come out of it, right, there should be a lot more activities aimed at increasing, group activities, right? Because, group dynamics do play a huge part in motivating someone to exercise more and all that. So I would certainly hope to see more of such group activities and all that taking place, where each and one another spur each other on to do more exercise.
Professor Yusuf, thank you very much for joining us this evening and for sharing your views. That was Associate Professor Yusuf Ali from the Chian School of Medicine at NTU.